Hi, my name is Keith Williams, and I just wanted to share with you a little bit about my story and why I'm participating in Rally for Our Lives today here at the Capitol, the state capitol in Harrisburg, Pennsylvania. This is critical. Home and community based services are critical for people with disabilities like myself and thousands of others across Pennsylvania to live with independence and dignity, and perhaps most important, with choice and with consumer control, so that people with disabilities, we can control our own lives and direct our own services. I am on the consumer model, self-directed model, where I'm able to recruit, hire, manage, and train my own attendants, and I've been on that program since 1987. The program is extremely valuable to me. It provides attendants to be able to help me with my activities of daily living, such as transferring out of bed in the morning, showering, bathroom, dressing, grooming, meal preparation, feeding, and so forth. My hours go with me. I'm employed full time at my Center for Independent Living in Scranton, where I'm the Advocacy and Outreach Coordinator, and I have been working there since 1987, employed full time. And since then, and even today, I have attendants help me at the workplace 2 times a day, at the workplace, at my office at the center. In addition, my attendants are able to help me when I go off site during the workday, for example. So if I have a luncheon, a business meeting, going to a conference, and I'm going to be needing some personal assistance, my attendants meet me there and help me for whatever length of time I need them. Also, my attendants help with everyday kinds of activities outside the house, like shopping or running errands or going out to eat. Basically, whatever's needed. So I know how the program has assisted me as a person with a significant disability for just about all my entire life, and I'm 61 currently. So you can just take that number and extrapolate it by thousands of people with disabilities who could benefit from programs across Pennsylvania, particularly people who are on Medicaid funded waivers. So I know that I'm only one person, but these experiences definitely apply to others. So if you're a legislator or a state official, I'm hoping that we can count on your support to continue empowering people with disabilities by making sure that ensuring that consumer control is maintained, that some of the ongoing issues and problems with managed care organizations are resolved as soon as possible, and so that people with disabilities can retain and even increase their independence. Thank you.
My name is Samantha Davenport. I live in Scranton and I have spina bifida. I've been on a waiver for since 2006, and the aids help me with getting ready for my day, cooking, cleaning, and helping me get ready for bed. The waiver has made me more independent, and without it, I would not be able to do my volunteer job at the local hospital, and it just gives me the freedom of being able to get out. I do have home modifications. We got new flooring, and I got pull down cabinets in my bathroom to make it easier for me. The waiver also helps me so I can help take care of my niece and my nephews. Thank you.
Hi, my name is Cassie Simpson. My date of birth is 11/3/89. I was born prematurely at 24 weeks with cerebral palsy. The waiver that I'm on helps me do things that I can't do independently, such as showering, transferring in and out of my wheelchair, um, brushing my teeth, stuff like that. Um, I also take college transportation. that I do independently thanks to the waiver. It helps me pay for my transportation. I'm also a part of a group for disabilities. It's called Voices of Ability. My parents helped me become as independent as I could be since I was a little girl. Thank you for your time.
My name's Dave. I moved here to Pennsylvania a while ago. I have lots of different disabilities, some that are not related to other ones. I'm supposed to be getting 25 hours a week of attendant care. My service coordinator through PA Health and Wellness is Elisa Ray, who is really great. Seriously goes above and beyond. Um, she tries to be able to get me an attendant. We've gone through so many different organizations just trying to find a worker that is available to come out to me. Uh, I think we've gone through like 7 different companies in the past year, just trying to find anyone that's willing to do the job, but nobody really wants to. They all seem to be working for any company that pays higher, such as like Walmart. I would like to be able to get somebody to actually show up to be able to do the job. So that way I actually would have the ability to be able to do laundry, uh, clean my apartment, be able to go grocery shopping, like cook, whatever. Different things that if your body worked, like mine used to, then it would be taken for granted stuff you never even think about. But for me, I need help with it. Without the services, such as like I am right now, I had to do different, like heavy lifting that I can't do, and I ripped the muscles off my left shoulder. So I got a rotator cuff tear on my left arm now. But because I don't have an attendant, I'm not able to rest and heal. Instead, I have to keep using that arm anyway, even though I'm literally ripping myself limb from limb. And I've got a pinched nerve in my spine now. And I still have to keep using it. Uh, if attendants were able to get paid competitively, then the different companies that hire them, they'd be able to do a more a higher quality interview process instead of just whatever random dude fills out an application and instantly gets the job. They could actually go through, who would be genuinely qualified and who's not. They're just so desperate for absolutely anyone right now that they'll hire people totally unfit.
Hi, my name is Jay Harner. I am the Supervisor of Short-Term Services and Supports here at the Center for Independent Living of North Central Pennsylvania, Roads to Freedom. I am a quadriplegic, C5, paralyzed from the mid-chest down. When I was 18 years old, I was on vacation at the beach and I had a swimming accident that left me permanently paralyzed for the rest of my life. For the past 24 years, I have been using waiver services. In January of '98, I started receiving services at home that allowed my parents to go back to work. At that time, my attendant started working at $8 an hour. 24 years later, my attendant today makes $11.54. These caring, giving, generous individuals work with no overtime, no vacation, no health care, and little pay. It is time that we support them and give them the earnings and the benefits that they deserve. It's time to pass a bill to support them and allow us to continue living in the community independently and safely. Thank you.
My name is Scott Eugene Anstein. I have not heard from anyone, and I feel like I've been abandoned. The services were very fair, and when I lost my aide, he died of a stroke, and since then, it's been lackluster performance from the company that are supposed to be taking care of me. Been at least 2 weeks, they haven't reached out and they haven't provided any services whatsoever. To be quite honest with you, I'm not coping very well. I have multiple sclerosis, and I have a broken arm. And unfortunately, I'm completely out of food, out of water. They know this, and I've reached out to them several times. I'll be honest with you, I'm all out of answers. It's 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 very demanding. That's to say the least.
Hi, my name is Dominique Howell. I am a recipient of home and community-based services. I currently receive 112 hours per week. However, I haven't been able to receive my total amount of hours due to a trusted attendant having to leave because the pay was inadequate for what she needed to continue to live and transport back and forth to work. Ever since she's left, I haven't had adequate care, which affects my family life and my job. The people that have been sent here, the direct care workers, have abandoned me on shift, have shown up extremely late. My shift starts at 7 a.m. in the morning, for example. Some people don't get here until 9 a.m. or 10 a.m., which means that my daughter can't go to school on a timely fashion, which is 8:30 a.m. And I'm supposed to be directly in front of my computer for work at 9 a.m. And so we have suffered a great deal. And the biggest part about it, the part that annoys me the most, is that my attendant did not want to abruptly quit her job. She was very upset about it. And we tried to rectify the situation by moving to another company, but all companies only cap out $2 more than what she was making. So she wouldn't really see a difference. And then either they capped out at $2 more or they only accept private pay, which I am a home and community-based service recipient, which means I am a CHC recipient. So it's been almost a month and a half now because we're almost in November, and she left the beginning of the middle of September, and we have struggled since then.
My name is Latoya Maddox. I too am a recipient of home and community-based services. I too was like Dominique with 105 hours a week, but my morning shift usually starts at 6 a.m. because I am a hands-on mom, so I like to get my son up for school, get him out the door for school, sometimes take him to school, and things of that nature. But due to the agency or the attendants not abiding by the schedule, not all of them, it's usually the ones that only work a few days a week, they were never on time. They were all a lot of times late, which made me late. And then I would have to ask his father to come assist with getting me up so that I could take him to school, or for him to come take our son to school. And I just wait for my attendant to come. So, I thought of getting 24-hour care, which is 168 hours a week, which, it works when it works, but it doesn't work when it doesn't work. And the way they have the system set up right now doesn't work for me, because if the home care agency is calling me once a month or for a week, basically towards the end of the month, saying your hours aren't authorized for the next month for your 168 hours, and you're going back to 105, and how do you want these hours divided up? That throws me for a whirlwind, because I have dual disabilities, so physical and mental health. So when you're calling someone abruptly, disrupting their day, and they're not expecting that call, it could do a lot to you. So, the service coordinator has to call me once a month for me to do just like a survey check-in. Has anything changed in the last 30 days that you've gotten service? And usually the answers are, well, all the time that now the answers have been no. Or is there anything else that you need? No, but that shouldn't have to be, unless we as consumers can speak for ourselves. As you see, Dom and I are both here talking to you all about our experiences, so you can see we can articulate and we understand very well how the system works. But for us to always have to reach out to a service coordinator, for us to always have to reach out to a doctor, for us to always have to reach out to somebody else about things that we need is unacceptable and unfair. And I too work a full-time job. Me and Dom, we have the same we share the same position. But it's just a lot on a person with a disability who wants to live their life and work, have a family, go to school, do all this stuff, and still have to navigate the home and community based service system now with the MCOs. Before, without the MCOs, everything went smoothly. Without CHC, everything. I mean, you had a few bumps in the road, but that was usually a service coordinator issue. Now it's you got to go through service coordinator. Not everybody gets a good service coordinator. Now you got to go through a whole bunch of loopholes. It should not have to be that way. And I feel as though consumer control is being taken away from us slowly but surely, and that's unacceptable.
And also, I feel like with the MCO situation, there have been more agencies pop up, but with less quality and less training. So if a company like mine, for example, is short-staffed and they need staff as soon as possible because it's agency model and not consumer option, they just hire whoever. And there's no mandate for specific training on how to transfer, how to do Hoya lift, how to present yourself. And there's no real mandate or no real punishment when somebody is 2 hours late, because they still have to process the hours through the MCO. And so I feel like the MCO has to take responsibility for the lack of mandates that are not in place and the lack of skill that are not in place. And this is all over. This is not just for one agency. I mean, we do this work and we see that every agency is suffering right now. And so you can't really put it on the agency right now. You have to look at who's the parent of this, what is going on. And so at the top of the chain is the MCO. And like Latoya said, they have made it harder for us to do what we need to do to remain independent. And our whole goal as people who work and as disabled folks is to remain independent and to be productive members in society. But if the MCO is not allowing us to do that, then where do we go? Back into congregate settings, back into nursing homes? That's impossible for Latoya and myself and so many others because we have children. We have children, and so we have to be present for our children. And without that, who are we? And unfortunately for me, this situation has affected my child a great deal because my child knew this person since basically birth. And so to abruptly have to leave and to be out of routine, because my routine is her routine and vice versa. So if it's messed up, it just messes up her whole day. I mean, her whole day, her whole month, the whole month has been hard on her, and she has her own disabilities as well. And so it hasn't fared as well. So I appreciate you all for letting us speak and hearing us out. And please, please, it is imperative that you make a change and you make a change soon for the living wages of the attendants and the prospect of all recipients of home and community-based services.
My name is Katrina Towns, and I'm sorry that I'm unable to be at the rally in person. I am sending out this message about some of the things that the state, or I should say community health choices, are not doing. They're taking away people hours. I am one person that they took away my hours, and I had to fight. I had to do an appeal to get my hours back. They also stated, they lied in the appeal, stating that I only need 2 things for services, and they were incorrect. So I'm assuming that they went back on recording and they fixed it. My caretaker is still missing 2 or 3 days from back in February. They are not paying the caretakers or aides or attendants their hours. Some attendants are going 2 and 3 months without pay. I'm also concerned about the transportation. We have a waiver for us to receive non-transportation funds. And we get them, it was fine, once Community Health Choices jumped in around 2019, roughly maybe 2018. Everything has been messed up as far as our transportation funds. Now we're entitled to this, so we should be entitled for distribution in the correct way. Keystone Community Health Choices allow MTM to dish out our transportation funds. And they have been screwing up since day one. They should just kept the mail in, not zone 2, paper trail pass, so people would be able to take care of their business. This month, November, and last month, October, I had trouble getting my zone 2 paper trail pass. This month, today is the 8th, and I still have not received it. It's inconveniencing to myself and thousands of people who are entitled to the non-transportation funding. We also are looking for our caretakers or attendants to have a raise in their pay. I think it's unfair to them that they suffer with $10 to maybe $13 an hour when Walmart and Target and everybody else, the increase in all the jobs due to the economy has raised to like 15 plus, and they don't even have it in the law yet. But people understand our livelihoods out here in the world since the pandemic. Please, I'm asking you to please have Community Health Choices, NTM, and together so they'll be on the same page length. And that's what I have to say. Thank you. Have a great day. Be safe.